1940s were defined by World War II, the baby boom era, and an influx of women entering the workforce to replace men who went to the First World War. A great push was made for occupational therapy services and once again played a key role in the care of wounded soldiers. Occupational therapists, distinguished with their new formal insignia as OTRs in 1940, addressed orthopedic, neurological, and psychiatric conditions with returning soldiers. Programs such as vocational training, industrial therapy programs, and clinical workshops were set up to assist newly discharged patients to help them readjust and develop tolerance to work. The U.S. Army War Emergency Courses in Occupational Therapy also begins in 1944. This decade marks the start of the rehabilitation movement, which is a time of immense growth and change in occupational therapy. During the rehabilitation movement, the intervention focus shifted from the use of arts and crafts toward rehabilitation techniques based on scientific methods. Emphasis was placed on reintegrating veterans into society, and therefore the use of activities of daily living, ergonomics, and vocational rehabilitation gained favor in therapeutic communities. With battlefield medicine focused on saving severely wounded soldiers, the development of prosthetics and orthotics also gained momentum during this period. Together with the GI Bill of 1944, the Mental Health Act signed by President Harry Truman in 1946 provided funding for mental health services and research. Rehabilitation expanded to assist veterans return to work as the amendments in 1943 emphasized physical and mental restoration, leading to a rise in curative workshops. In 1949, guidelines for OT education were expanded through the Council on Medical Education of the American Medical Association, or the AMA. The establishment of the Essentials of an Acceptable School of Occupational Therapy represented the first cooperative accreditation activity by the AMA. It states that those that being trained in occupational therapy are to work under the direction of a qualified physician and not as independent OT practitioners. Fun fact, a new registration exam is tried in 1943 but was found unsuccessful due to difficulty in grading the essay portion. Therefore, multiple choice questions are added in the examination in 1947.
During the time of the 1940s, female therapists wore white coat dresses with an occupational therapy patch on the sleeve. In some instances, therapists also wore a small hat similar to a nurse's. Patients during this time were primarily wounded veterans, so they often wore hospital garments such as a hospital gown or shirt and pants, or in some cases, we also see them wearing their military uniforms. As we see a big shift in the war effort during the 1940s as a result of World War II, there was not only a shift in men fighting overseas, but a change in the occupations of a woman as well. Prior to this era, a woman's occupation may have composed of fulfilling the role of a homemaker, so cooking, cleaning, and taking care of the family may have been her primary occupations. However, in the 1940s, we see a change in these occupations to more manual labor. Most of the population during this era, both women and men, assisted in working with aviation equipment, operating machinery, and participating in occupations that required the use of the hands, such as carpentry. Fun fact, it is during this time the iconic heroine, Rosie the Riveter, is seen everywhere. She is most notably symbolic for the shift in women contributing in war effort areas, such as aviation. It is during this decade in 1942 that we lose one of the most influential figures of occupational therapy, known as Eleanor Clark Slagle. She is known as a founding member of AOTA and served as the president, vice president, and secretary during her time as a member. In paying homage to her legacy, the AOTA created the Eleanor Clark Slagle Lectureship Award to recognize those who have risen above and beyond in contributing to the practice of occupational therapy. The first lecture was awarded after this era in the 1950s. One of the most prominent occupational therapy professionals during the 1940s was Winifred Conrick Kamen. As Chief of Surgeon General's Occupational Therapy Branch, she led the change in the insignia of occupational therapy. Because of her, in this decade, officials came to an agreement to raise the title of occupational therapy to a professional classification. In 1947, she became the first female registered occupational therapist to be elected AOTA president and most notably propelled the publication of the first AOTA journal. This particular journal's first editor was a woman by the name of Charlotte Bone. Two other prominent figures during the 1940s were Helen Willard and Claire Spackman. Both occupational therapists were instructors at the Philadelphia School of Occupational Therapy and contributed to the world of occupational therapy with the publication of their textbook titled Principles of Occupational Therapy. This textbook was published in 1947 and is still used till this day, but is commonly known as Willard and Spackman.